Okay, now we are going to continue now with the mechanism of infections. The mechanism of infections. Now, you need to know that every time we are just speaking about infections, and infections, but we are not actually understanding the mechanism of infections. Is it clear? Now, you need to know that generally infections are being had in generally infections have what is called a causative agent. So you have a causative agent for every infections. That one is already known. Is it clear? But we need to know that what the causative agent is just the cause of an infection. In the mechanism of infection, in order for you to understand the mechanism of infections, you need to know certain terms, the certain specific terms which are going to be very peculiar. Is it clear? So, what are the terms that you have to know? The first term that you have to know, apart from infections, you have what is called contamination. Basically, contamination. Contamination is the presence of a causative agent or a microorganism at the site. Contamination is the presence of microorganism at the site of a point of focus. It can be in a GI tract, it can be at any location without it reproducing nor causing any immune response. Is it clear? So contamination is just the presence of microorganism without it dividing nor causing an immune response. Example, if you have a wound somewhere, the wound, when every time a wound is already exposed, say you have an open wound, that wound is going to be contaminated. Is it clear? Because you are going to have the normal flora at the skin is going to contaminate that wound. But contamination does not necessarily means infections. Is it clear? So that's why these are certain terms that you have to put in mind. So now after contamination, the second term that you have to put in mind is now colonization. Now, for colonization, you need to know that what it is the presence of microorganisms and they are actively dividing. Is it clear? So, colonization is the presence of microorganisms and they are actively dividing. So, if you have microorganism plus actively dividing, that is called colonization. Now, the third term is now infection. Infection is the presence of microorganisms who are actively dividing and causes an immune response. So it's the presence of microorganism, the presence of microorganism plus actively dividing plus causing an immune response. Is it clear? So now when you have microorganisms that are actively dividing and causing an immune response, that one is called infection. Is it clear? So infection is you are not terming infection if there is no immune response. Is it clear? So if there is no immune response, that is not called an infection. Infection is only when the microorganisms are actively dividing and it results to an immune response. Is it clear? So now you need to know that what the major problems of infection is not actually the presence of the microorganism, but it is the immune response. Is it clear? Now, the immune response to an infection can be either over, we can have overstimulation of the immune response, or you have understimulation of the immune response. Is it clear? So that is the actual problem of infection is not actually the microorganism. The microorganism, you are going to treat it in a pathogenesis, but the actual problem is the immune response. And in the immune response, you can have overstimulation of the immune response, or you have understimulation of the immune response. Is it clear? In the case of overstimulation of immune response, you're going to have hypersensitivity reactions. Is it clear? Hypersensitivity reactions, and you are going to have all the signs of inflammation. Is it clear? You can have even excessive inflammation that can result to disorders. Now, for under stimulation, now the microorganisms which are actively dividing, and they are the one that is actually going to cause the problem in infection. Is it clear? So I hope that you understand the mechanism. So the terms before we are going to explain the mechanism. Now, after understanding those basic terms of contamination, colonization, and infection, you have to understand what is also called the mechanism of infection. Now, you need to know that what? You need to know that the presence of a microorganism, somewhere, a presence of microorganism in a focus, the presence of microorganism in a focus, the first step is that you are going to have a contamination. After contamination, the second step is that you are going to have colonization, meaning that the microorganisms are going to get actively dividing still in a point of focus. Is it clear? Still in a point of focus. Now, after the microorganisms are going to be actively dividing, they are going to now result to the third step, which is an infection at a point of focus. Is it clear? You're going to have infection at a point of focus. Now, if the immune system cannot control the infection at the point of focus, that is when now you're going to have a systemic spread of the infection. You're going to have a systemic spread of the infection. So generally, you can just summarize your mechanism of infection to be: you're going to have a point infection, you have a infection of a point of focus, and then you have general spread. Is it clear? So you are going to have first infection at the point of focus, and then you have general spread. So that is how you are going to consider causative agents. So the causative agent is going to start from the point of focus, and then it's going to go to the general spread, except the causative agent is directly inoculated into the blood.